Hi everyone, I am Dr. Devyani from Dr.dentico, and today we are going to learn about an exciting topic which is clinical diagnostic aids in oral and maxillofacial surgery. We will be referring to Nilima Malik's oral surgery book for some valuable insights. So let's get started and discover how important diagnostic imaging is in our dental practice. So starting from what is the diagnostic imaging? It is like having magical eyes that help us see things hidden inside a patient's mouth. As dental professionals, we use it for different important purposes. So, the main role is for identification and treatment plan. So, when a patient comes to us with a problem, we use imaging to find hidden issues like cavities or infections that we can't see from outside. Then, checking for abnormalities. So, sometimes patient has pain but we don't know why. With imaging, we can check inside to find any hidden problems causing this discomfort. Then, determining size, site, and nature of abnormalities. So, when we find something unusual like a cyst, imaging help us know exactly how big it is, where it is located, and what it looks like. Then, in treatment plan, we use the information from imaging to create a special plan for each patient so we know the best way to help them. Then, imaging objectives. Our goal is to get right information at the right time so we can make good decision for our patient. Next is decision making in diagnostic imaging. So, as dental professionals, we don't just take pictures, we make important decisions too. So, here what we do. First one is timing of image acquisition. So we decide when it is best to take images. For example, if someone has a dental emergency, we take images right away to see what is going on. Then second is selection of imaging modality. So different patients need different types of imaging. For example, some patients might need an X-ray while others might need a 3D scan. Then designing a procedure specific to clinical needs. So each patient is unique. So we make a special imaging plan just for them to make sure we get the right information. Then precise extent of lesion for specific diagnosis. So when we find something strange in the images, we measure and study it carefully to know exactly what is going on. Next, moving to fundamental tenets of imaging modality. As we take images, we follow two important rules. The first one is maximum accurate diagnostic information. We want to get the best information possible so we can understand our patient's problem well. Second is maximizing benefit risk ratio, and we are following a LARA which is as low as reasonably achievable. So we want to get great information, but we also want to keep our patient safe. So we make sure to use imaging techniques that have low risk. Moving to goals of diagnostic imaging. So when we use diagnostic imaging, we are following some goals. The first one is developing virtual operative environment. So we can use imaging to plan and prepare for surgeries without even touching the patient. Second is previewing patient's anatomy in 2D and 3D. So with imaging, we can see our patient's mouth from all angles, which help us understand complex cases. Third one is analyzing and measuring deviation from normal. So we use imaging to see what is different from the normal. So we know what needs to be fixed. Next is stimulating an optimized and practical operative solution. So we use imaging to find the best way to fix our patient's problem, making sure our treatment plan is effective and practical. Next is accurate method of intraoperative navigation and measurement. So during surgery, we can use imaging to guide us and measure things accurately. Next is efficient and accurate information transfer. So we can show images to other doctors or specialists to get their help and make sure we are doing the right thing for our patient. Next one is accurate documentation and qualification of lesion. So we take pictures to keep a record of what we find so we can track our patient's progress and remember important details. Moving to next imaging modalities. So basically we have two type of imaging modality. The first one is invasive or interventional. Second is non-invasive technique. So starting with invasive or interventional. So in this, we are using this modality for diagnostic, therapeutic and curative purposes. For example, embolization, coronary angiography and coronary angioplasty. So in embolization, this is when we block the blood supply to a certain area. It can be helpful for treating some special problems. Next is coronary angiography. It is a way to look at heart's blood vessel to see if they are blocked. Another one is coronary angioplasty. It is a treatment to fix blocked blood vessels in the heart. So, in this diagram, we will see embolization. So, this is abnormality present in body. Okay. So, we just want to block blood supply to this particular area. So, we will insert a catheter from this artery, and through this catheter, we will inserting some embolization agents. Now this agent will block these arterioles so that blood supply is blocked from this particular area. So with the time, this abnormality will be necrotized. Okay. Next is coronary angiography. So in this angiography, we will insert catheter, and through this we will be going to insert a dye material, and through this dye we can see how much and location of blocked artery. Now moving to next, which is angioplasty. In this image, in first you can see cholesterol, right? This is a cholesterol. So it is partially blocking blood flow through the artery. Now we will insert a stent with balloon inserted into partially blocked artery. So this is how we will going to insert a stent with balloon. Now once it is inserted and reached at its location, we will just inflate a balloon. So balloon inflated to expand a stent. Now balloon will be removed from expanded stent and stent remain there. Now moving to next, which is non-invasive techniques. So most of the time we use safe and non-invasive imaging methods in dentistry. So here are some examples. The first one is plain conventional radiography. So it is like a simple x-ray that help us see teeth and bones. For instances, when a patient comes in with a toothache, a dental x-ray allows us to see if there is a cavity or an infection in the tooth. Then second is computed tomography. It is a special 3D scan that gives us more detailed images, great for tricky cases. For example, when planning for dental implant placement, a CT scan helps us visualize the jawbone and its density, ensuring precise implant positioning. Next is magnetic resonance imaging, which means MRI. It gives us clear picture of soft tissues like muscles and nerves. So when dealing with a suspected tumor in the jaw or facial area, an MRI helps us see the extent of tumor and its relationship with surrounding structures. Next is radionuclide studies, for example, scintigraphy or bone scan. This use a tiny amount of special material to look at bone health or find hidden problems. For instance, in cases of suspected bone infections or bone tumors, a bone scan using a small amount of radioactive material which help us to identify problem areas. Next is ultrasonography. So it uses the sound waves to create images, and it is useful for looking at soft tissues and blood flow. So when evaluating salivary gland conditions, an ultrasound helps us to visualize the gland structure and detect any abnormality. So this is image of plain conventional radiography. In this you can see OPG, which is 2D. Next is this CT scan, which we use for dental implant. This one is MRI, which is magnetic resonance imaging. Okay. Next is this radionuclide studies. So we will just insert radioactive material like iodine, and then we take a x-ray so we can find a lesion over there. Okay. Now next is this ultrasonography, which is used in dentistry. Okay. Now conclusion. So in conclusion, diagnostic imaging is like a superpower for us dental professionals. It helps us see what is hidden, plan the best treatments, and take good care of our patients. So we use imaging to make important decisions and keep our patients safe and healthy. So let's keep learning and using this wonderful tool in our dental journey. Now it's your turn. If you have any questions or need more some explanation, let me know in comment section. So thank you all for joining me in this exciting lecture. I hope you found it helpful and inspiring. Keep smiling and keep shining in your dental careers. Thank you.